Performing at a high level in sport requires training at a high level. But what if I told you that the key to peak performance isn't just how hard you train, but how well you manage fatigue? Today, we're diving into the science of monitoring and managing fatigue in sports so you can optimize performance, prevent injuries, and keep your athletes at their best all season long. Let's explore. Managing fatigue is no easy task. For example, basketball has one of the longest and most grueling seasons in sports. With up to 100 games in an NBA season, and over 30 games in a college basketball season, athletes experience cumulative fatigue that can lead to performance drops and, at worst, injuries. Strength and conditioning coaches must quantify workload and fatigue to find the balance between training, competition, and recovery, which again is no easy task. You can use objective and subjective monitoring tools to help, and understanding internal versus external workload will also play a role. And all of this together will help coaches track fatigue and make informed decisions about their training loads. So let's unpack what fatigue is, the testing options we have to assess it, the types of workload that fatigue athletes, and a few strategies to help your athletes recover and perform at a high level. And one of the biggest mistakes coaches can make is relying too much on one test type, whether that's objective or subjective. Starting with objective testing, right? This is measured with data and technology. The easiest example, the one that I'm most consistent with, is counter movement jumps on force plates. This is going to allow you to measure neuromuscular performance and fatigue. And as a brief side note, if that's of interest for you and you want to increase your knowledge of force plate testing, I have a course on it. I'm going to link it below, and in just a few hours, you'll learn everything you need to know about jumping with force plates. But that's not the only test type. Sprint speed is an option, right? You could take 5-meter or 10-meter split times that would identify fatigue through their acceleration declines, right? Are they taking longer to perform these split times? Now that's, I would argue, a little bit harder to put into place because it's much harder to actually have an athlete sprint than just jump. You're going to want to spend some time warming them up. Heart rate variability comes to mind, right? This is an option to track autonomic nervous system response to the workload. You're going to need an app or some type of finger sensor, but you're going to want to find a way to get that. Now, if you're going to employ that, you're going to want to make sure that you're very consistent with that, because things like caffeine, for example, coffee in the morning, are going to affect that heart rate variability. So you just want to be really consistent with when you're tracking that. Biomechanical and biochemical markers. So maybe creatine kinase, for example, comes to mind. Testosterone cortisol ratios. This becomes a little bit more invasive, but it is going to provide that insight into physiological stress. Those are a little bit harder to do in team setting. I don't know a ton of people that are doing biochemical markers, but I do know a ton of people that are doing the counter movement jumping and even the heart rate variability, right? Those are easier options probably to put into place from an objective perspective. Now, the pros of objective testing: it's accurate, it's quantifiable, and you can compare it across time. The cons: it's going to require technology, and you're going to need some expertise to interpret the data. And again, if force plates is of interest, there's a link below for a course on that. Now, subjective testing is the other side of the coin. We talked objective, let's talk subjective. This is self-reported feedback. A few options. Wellness questionnaires are the easiest to employ. Players can rate their sleep quality, their stress, their muscle soreness, their mood. A quick note on that: if you're going to use a wellness questionnaire, don't turn it into a 10-question survey. I will limit your questions to really 1 to 3. Right, which sounds crazy. I'm just going to ask them one question. If you have one question that is, how ready are you to play today, or how ready are you to compete today, that might give you a ton of insight, right? The other option from a subjective perspective is session RPEs. These are probably the two most popular: wellness questionnaires and session RPEs. Session RPEs, on a scale of 0 to 10, how hard did that session feel? Quick note there: if you're going to use session RPEs, I would encourage you to probably delete the number 7. Because what I have found is that athletes oftentimes will report 7 because that's somewhere between really hard and kind of moderate, right? That's right in the middle of basically 5 to 6, which is moderate, and then 8 and above is probably hard. And so oftentimes athletes don't want to commit to either of those, so they just say 7. So what I would do is say, hey, on a scale of 0 to 10, but you can't say 7, how hard was that session? And that's going to kind of force them to choose, was that moderate or was that hard? Right. The pros: this is super easy to implement. Literally, you can have an intern or yourself walk around with, we used to do it with literally just a laminated questionnaire on a clipboard. We would write that down, and then we would stick that in Excel, and then we would be able to track that. Right. The con, though, is that this is your athlete's perception. And so they can manipulate that data pretty easily. Right. I had one athlete that would give me the same answer all of the time. And if that's the case, then that data is not very useful, right? They're giving you the same thing every day. It's not a reflection of their workload. It's just them telling you the same number. So be conscious of that. Best practice is probably to combine the two, objective and subjective. And that's really what you would want. You would want to track them both. In a perfect world, they would track together, right? But at times there's going to be some discrepancy there, some divergence, and that might be telling, right? If objectively we're seeing that they shouldn't be very fatigued, but subjectively they are, that might be telling us that things that we're not tracking are playing a role, right? So maybe if you're not tracking sleep, maybe the workload on the court or the workload in your sport is not very high. The training loads in your weight room aren't very high, but they're not getting a ton of sleep. And so those workloads now feel much harder than they should, right? So the divergence between objective and subjective can be valuable. Next, let's talk internal versus external workload monitoring, right? So we talked test type, but now let's talk types of workload. So internal versus external workload monitoring. This is the workload that our athletes perform, and that's going to drive fatigue. And we can break that workload into two categories: what the athlete is doing, which we call external workload, and how are they responding, which we call internal workload. So for external workload, what is the athlete doing? Ways that we can track that: micro technologies like GPS, accelerometers, IMUs. These are ways for us to track sprinting, acceleration, and jump count. So you might see, for example, distance covered in a game, right? NBA athlete covers 2.5 miles in a game. That's being tracked with some of this micro technology or local positioning systems in the arena. You can get things like player loads or work rates. This is going to be quantifying the demands, physiological and biomechanical demands of the sport. Pros here: this is going to show how much work is actually being performed. The cons is it doesn't tell us how the athlete is actually handling it, right? Two athletes can go out and cover the same amount of distance, but that doesn't necessarily mean they're responding the same. So the external load could be the same, 2.5 miles, but they can actually be responding to that very differently, right? And so the way that we track their response is that internal workload. Heart rate monitoring is an easy one. This is going to track that cardiovascular response. We talk session RPE, and this is a way to indicate the perceived difficulty. Heart rate variability is another option here. And so we'll see that the test types can align with the workload types, right? This is going to measure nervous system recovery, that HRV. There's some limitations there, but those are just some options. The pros and cons for the internal workload measurements. It's going to provide insight to that fatigue, stress, and recovery. This is that individual response. The cons that it can vary based on external factors like stress, sleep, nutrition. And so if we're not tracking those in tandem, then we're going to ultimately have to question, why are they responding this way? But understanding how they're responding to the workload is important and is relevant. Now, best practice, again, monitor both. An internal and external way that we can track this, right? One way that I like to do it is start to consider the on-court demands or the external demands, and then pair that with some type of response. So a counter movement jump is actually an objective internal response as well. Not all athletes are going to respond the same to the external workload. We've actually published research on this. Some athletes are going to have more neuromuscular fatigue than others. And so you can see that, right? So that's a way for us to get objective external workload, tracking what they're doing on the court, with objective response. That's a nice option, and that would be best practice. If external workload is high, but internal workload is low, the athlete's adapting well. If the internal workload is high, but the external workload is low, they may be fatigued or not recovered well enough, right? And maybe downstream from that becomes overtraining and injury and those types of things. Moving on, right? We've already talked objective and subjective testing, and we've talked internal, external workload. Now let's talk about how we can manage the fatigue for performance at a high level. So now that we know what fatigue is, the testing and workload types, let's talk about a few strategies you can implement throughout the year to manage fatigue for your athletes. Starting with the preseason and training camp period. Players need to build workload capacity so they can handle the demands ahead, right, with that in season, but they want to be careful not to overtrain. And so a general rule that you can implement: track the increases in external workload and then put a limiter of about 10%, right? And that's very flexible. Some athletes can handle 20 to 30% increases, probably not for consistent weeks, but week over week, that might be okay once or twice. Other athletes are going to struggle when you get above 10%. So 10% becomes a nice rule to just track. I'm not going to suggest that you never go above it, but just know that the more that you go above that, the more fatigue that you'll be inducing. Best practice would be to track probably CMJ if you can. Maybe sprints if you have that, but again, that's harder to implement than CMJs, excuse me. And then don't forget about that subjective stuff, wellness questionnaire, session RPEs, right? So track those over time to see how your athlete is adapting through this period. We get into in season, right? We're going to want to monitor fatigue to ensure that you're helping your athletes recover prior to and before that next game, right? So prior to and then after games, right? CMJs are nice here. Again, you continue to hear me talk about the CMJs just because that's what we do at a pretty high level. Now, you're going to want to factor in things like travel, sleep, turnaround times between games, game congestion, right? Tournaments, all of those are playing a role now, where in the preseason they weren't because you weren't really dealing with that. You also are going to want to consider your position-specific demands. So, for example, your guards in basketball will cover more distance, but the bigs are going to have fatigue from contact stress, right? And that's going to influence potentially their need for recovery, right? So you want to think about that. Again, best practice, adjust training intensity and duration based on the fatigue your athletes are having. So if they're more fatigued and they're showing up fatigued, you want to be conscious of that. You want to alter your training plan because of that. If they're coming in, they're well recovered, you can tell internally they're responding well, we might want to actually continue pressing on the gas here, right? So let's talk recovery strategies, right? Sleep and nutrition, the ultimate performance enhancers. You would have active recovery sessions. This is something that I like to implement. Maybe after a game, the next day we'll come in for a 30-minute recovery session. And we're going to do some active movement, some low intensity stuff just to get some blood flowing. Recovery modalities can play a role, right? Cold therapy, compression, vibration, all the other tools that are out there. Those can be useful, but it's important to appreciate that those should be supplementing your sleep, your nutrition, and your appropriate training loads, right? So don't think that you can eat poorly and just hop in a cold tub. That's probably not going to work, right? No massage gun can overcome poor sleep and overtraining. Best practice, can you individualize your recovery based on your individual player responses and preferences? Use that data that you're monitoring to guide some of that. So I know I went through a lot, right? We've talked objective, subjective testing. We've talked internal, external workload. And we've talked about different phases throughout your season to keep your players or your athletes healthy and performing at a high level. Let's talk about the key takeaways here. Fatigue is both subjective and performance-based, so you want to use multiple tracking tools. Combining your external workload and internal workload is probably going to be the best approach. Things like GPS and accelerometry, paired with session RPE wellness questionnaires, right? Those can come together nicely. It's going to give you a full picture of your athlete's readiness. Managing fatigue is about adjusting workload, not just reducing it. That's a big one, with the big push, especially in the NBA, for workload management, players sitting out a ton. We don't need to unpack that. That's a whole another episode for itself. But just know that it's turned into, I think, at least publicly, where it feels like it's always the pull back on workload. But to me, managing fatigue is not about pulling back. It's about adjusting appropriately. Sometimes you need to press on the gas so you can prepare your athletes for the demands ahead. And if you don't do that, then they will be fatigued later because they weren't prepared for the demands that they're obviously going to have to take on. So just know that it's not always the brake, it's the brake and the gas, right? It's both of those to manage this thing. So smart training is going to lead to peak performance when it matters most and allow your athletes to recover from those grueling demands ahead. So I know that's a lot. We're going to end it there. If you're coaching athletes, monitoring fatigue is non-negotiable. Use the right data to optimize training, prevent injuries, and keep your players healthy all season long. If you found this episode useful, do me a favor, hit the subscribe button. You can drop me a comment, and I'm going to link to another video on sleep, which I think would pair nicely with this because sleep is probably our ultimate cheat code. It's our hack for recovering at a high level. And if you want to avoid fatigue, you're going to want to recover. So I'm going to drop that link as well. Again, hit the subscribe button, share this with someone. I'll see you next time.